Imagine performing love in front of millions of people while feeling a stabbing pain in your lower abdomen. A pain so sharp it takes your breath away. That is exactly what happened to pop star Miley Cyrus right on stage during her New Year's Eve performance with Dolly Parton. What caused it? A ruptured ovarian cyst. And her story is a reminder of something millions of people experience without even knowing: ovarian cysts. Hey everyone, welcome back to The Psycho Nurse, your home for mental health, medical education, and real-life stories that matter. Today we're diving deep into ovarian cysts. What they are, why they happen, symptoms you should never ignore, and the life-threatening complications they can cause. This video is for students, nurses, future clinicians, and anyone who simply wants to understand their body better. Let's start with the moment that sparked this conversation. Miley Cyrus revealed that she once suffered an excruciating ovarian cyst rupture right in the middle of hosting a live show. She felt a sudden, sharp pain like something tore inside her abdomen, but she pushed through the performance before rushing to the hospital afterward. This is not uncommon. Ovarian cyst ruptures can feel like a knife-like pain, sudden pressure, or severe cramping on one side. The pain can radiate to your back or thigh, and sometimes it even causes nausea or dizziness. Most cysts don't rupture, but when they do, it can be a medical emergency. So, what exactly is an ovarian cyst? An ovarian cyst is a fluid-filled sac that forms on or inside an ovary. They're incredibly common, especially before menopause. In fact, most people with ovaries will have at least one cyst in their lifetime, and many won't even know it happened. Most are harmless, most cause no symptoms, and most disappear on their own. But not all cysts behave the same. There are several different types of ovarian cysts, and the most common are functional cysts. These form during your normal menstrual cycle. You have follicular cysts, which happen when the follicle doesn't release the egg and instead fills with fluid. These are usually painless and go away within 1 to 3 cycles. Then there are corpus luteum cysts. After ovulation, the follicle becomes the corpus luteum. If it fills with fluid or blood, a cyst forms. These can cause some mild discomfort but usually resolve on their own. Next, we have cystadenomas. These grow on the ovarian surface and can be filled with watery or mucus-like fluid. While they are benign, they can grow extremely large and cause a lot of bloating or pressure. Then there are dermoid cysts, also known as teratomas. These are one of the wildest types because they can contain hair, skin, fat, and even teeth. They develop from embryonic cells, are usually benign, and are more common in younger people. Another type is endometriomas, often called chocolate cysts. These occur when tissue similar to the lining of the uterus grows on the ovary and fills with old blood. They are often painful, are linked to endometriosis, and can impact fertility. Finally, there are malignant cysts. Now these are rare, but they're solid and cancerous, so they require immediate evaluation. They are more common after menopause and must be taken very seriously. So how do you know if you have a cyst? Well, some cysts cause no symptoms at all. You might only find out during a routine pelvic exam, an ultrasound, or a scan for something totally unrelated. But other cysts can cause pelvic pain, bloating, a feeling of heaviness, pain during intercourse, irregular periods, or sharp or dull aches on one side. These symptoms can worsen around your cycle, during exercise, or during sex. Now let's talk about the dangerous part: complications. The first one is ovarian cyst rupture, which is exactly what Miley Cyrus experienced. The signs include sudden severe pelvic pain, internal bleeding, dizziness or weakness, and pain that spreads across the abdomen. This is an emergency. The second major complication is ovarian torsion. This happens when a cyst grows so large that the ovary twists around the ligaments holding it in place. The symptoms are severe one-sided pelvic pain, vomiting, and a very sudden onset of that pain. If it's not treated quickly, the ovary can lose its blood supply, which is a very serious problem. So, when should you seek help? You need to go to the EA immediately if you feel sudden, intense pain, pain accompanied by fever or vomiting, or if you feel faint, dizzy, or have a rapid heartbeat. You should schedule a doctor's visit if you notice persistent pelvic discomfort, ongoing bloating, pain during sex, or changes in your menstrual cycle. Ovarian cysts are common and most are harmless. But the rare complications can be dangerous, and Miley Cyrus's experience is a powerful reminder that we should never ignore our bodies. Pain is communication. Listen to it. If you found this helpful, don't forget to like, comment, and share this video to help more women and nursing students learn about ovarian health. And as always, this is the Psycho Nurse bringing clinical knowledge to life. Stay healthy, stay informed, and I'll see you in the next video.